When you're thinking about getting a throat culture, it's to evaluate symptoms of sore throat, a fever of unknown origin, or even to identify a chronic carrier of recurrent infections. And really, you're trying to find out why the person has pharyngitis. Is it bacterial? Is it related to an STI like gonococcal? Is it viral or candidal? When doing a throat culture collection, and we'll do this week as well, you'll have the patient seated with their back against a chair because this prevents patients moving away from you when you're attempting to get the swab. You'll have the patient tilt back their head and open their mouth wide, and you'll use a tongue depressor to move the tongue out of the way, so depress the tongue. You want to swab both tonsillar faces. You can see that here in this image. This is between the palatoglossal arch and the pharyngeal arch. You also want to get the posterior pharynx. And if there's any obvious areas that are inflamed, ulcerated, or have exudate, you would like to get samples of those as well. But you don't want to contact any other part of the mouth, and you want to try to avoid the uvula hanging from above. That will trigger a gag reflex. Typically, a throat culture in the lab is grown on a blood agar plate, which identifies the most common bacterial pathogens. We're looking for a strep pyogenes or group A beta hemolytic strep or Candida albicans. You also can sometimes see them grown out on a chocolate agar plate, which would identify Neisseria gonorrhoeae, Neisseria meningitidis, or Haemophilus influenza. Another consideration is could you just instead do a rapid strep screening kit? You would collect the sample the exact same way as a throat culture, but then you place the swab in this test kit. You add this reagent to extract a cell wall antigen, and you'll follow the instructions associated with said kit to either get a positive or a negative result. And this would tell you is this strep pyogenes or your classic strep pharyngitis infection. Some special considerations to look out for. If you're looking for diphtheria or if you suspect diphtheria infection, you must notify the lab prior to sending the sample because they need to use a different type of agar, a tellurate agar. And if you are considering whooping cough or Bordetella pertussis, instead of using a pharyngeal swab, you use a nasopharyngeal swab, kind of like what was used for our COVID viral antigen detection. And you'd inoculate this, well, the lab would, on a charcoal plate. And when you place, after you collect the swab, you would either place in transport media and send to the state public lab, or you'd use a DNA PCR test, which is also a nasopharyngeal swab, which you can get results within 24 to 48 hours pretty quickly. Another respiratory culture, but lower respiratory tract, is a sputum culture. Indications here would be lung cancer, TB, or maybe a pneumonia that wasn't responding to typical antibiotic course. If the patient had abnormal chest X-ray, a productive cough, and negative bronchoscopy, or if typically we'd see bronchoscopy or lung biopsy used more often now for things like lung cancer. But some interfering factors with a sputum culture. You do have to rinse out your mouth prior to getting the sample, and it can be hard to actually cough up sputum, especially on demand. So sometimes saliva is submitted instead, and it's not going to work the same when it regards to growing out bacterium. The goal for the sputum culture collection would be the first morning sample. You get sputum from a deep cough and you expectorate it into a sterile container. You really want thick mucus, not saliva. And then these samples are refrigerated without preservative. The lab then inoculates it onto a supportive media to grow and can perform antibiotic sensitivity. But this is often for an additional charge. Malignancies like a trachea, bronchus, or lung malignancy can be helpful with sputum culture. Any benign cellular change due to infection, and some pathogens we could see Staph aureus, strep pneumoniae, common cause of pneumonia, Haemophilus influenza, or even Klebsiella.